You have needle points or acupuncture points that relate to your organ systems in your face. And so from a Chinese medicine point of view, working on these areas and opening up and invigorating these points can have a larger effect on your whole system.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I'm doing pretty well. You know, I've been just poking around at our knowledge base, and I feel like we need to do a little bit more poking. What do you think?
Oh my God, are you referring to needle poking, I hope? Because we're going to talk today about acupuncture, which I find fascinating in general, but it's even more intriguing to me when we try to do it in the realm of aesthetics, right? It's really something that sometimes it's hard for me to wrap my head around, so to speak, and get to the core of that issue. Maybe we could use some help?
Oh, absolutely. And acupuncture it is. So today we're talking to Sandra Chiu. She's an acupuncturist, Chinese herbalist, and founder of Treatment by Lanshin. She's been in practice for over a decade. She's spoken at the Integrative Dermatology Symposium before, Hadar. We know her well. And she's been treating skin disorders and also looking at rejuvenating skin using the unique approaches that you find within Chinese medicine. And Sandra, we are super excited to have you on the podcast.
I am super excited to be with you.
And Sandra, we know that Chinese medicine really encompasses a lot of different practices. Perhaps you can give us a bit of a background about what you do in practice, parts of it, the whole thing, just some parts of the practice.
So yeah, Chinese medicine encompasses many different practices and techniques. So most popular is acupuncture. I think Chinese herbs is also fairly well known. And nowadays, pretty much everyone, I think, well, I shouldn't say everyone, but a lot of people have heard of cupping and Gua Sha, as well as a little bit more under the radar is moxibustion, which is like an ancient infrared heat therapy. And I practice them all. And I find that for aesthetics and cosmetic work, using these Chinese medicine tools, it's useful to use them all and to be able to look at your patient and determine, based on what their concerns are or what their issues are, which set of tools would work best. So sometimes I use them all, sometimes I use a few in combination, but I need to have all of them at my disposal for successful work. So I've been doing that. I've been using Chinese medicine tools to restore, rejuvenate skin. So basically for aesthetic work for a while now, almost a decade. I've actually now been in practice for almost 2 decades. And I also treat skin using Chinese herbal medicine. So I do treat dermatological conditions as well. But for the purpose of this conversation, I do have a focus in cosmetic treatments using TCM, which is short for traditional Chinese medicine.
You know what's funny, Hadar? Do you remember Michael Phelps and all the cupping bruises that he had on his back?
Yeah.
I mean, we already knew about cupping before this because, you know, we've gotten a few friends now that we've collected in all kind of fields. But man, that really got people talking about cupping in general. Sandra,
Yes.
You know, you're talking about aesthetics. What I find really interesting in the aesthetic world is when you come at it from the conventional perspective, where typically, I think most people are talking about like injections of fillers, which really is hyaluronic acid and meant to be something that can give a little bit more volume. On the flip side, you have botulinum toxin, which is really meant to affect how the muscles move. And that got me really thinking about facial acupuncture and even perhaps Gua Sha. How do they work for aesthetics? Is it similar principles on muscle movement, or is there something else going on? How do you approach that?
I think there's a few different things going on, but One is very similar, and we think along the same lines as what you're thinking about when you're injecting neurotoxin or neuromodulator, where you're trying to disable the muscle to function altogether. What we can do with an acupuncture needle is actually effectively release muscle tension. So as you know, muscles, when they're tense, and I think it's, for most people listening, you can really understand this when you think about tight muscles in your neck or tight muscles in your shoulder. Now, many of you may have experienced acupuncture and how that can release a tight muscle in your neck, in your back. And the same thing can be done for facial muscles. So let's say, a very common area where you might do that is on the corrugators and in the procerus, precisely the same areas that you would inject neuromodulator. So, but rather than disabling the muscle function altogether, what we're able to do is, if someone has a really tight, overused muscle, then needling into that can release and lengthen that muscle. And effectively what that does is it brings a lot more blood flow into the area, brings nutrients into the area, and the local tissue just becomes much more supple. So though we cannot disable those muscles and create almost what looks like an erasure of the line, which you can do with neuromodulators, we can't get that far usually with acupuncture, but we can get a lot farther than one might imagine. And so what we can effectively do is soften lines and soften wrinkles with a needle. But I would say that what we can do that I don't think you can do, and you can let me know if I'm wrong, Raja, is with neuromodulator, I'm not sure that is it bringing more blood flow and suppleness into the tissue? Is it sort of elevating that overall health of the local tissue area, by bringing more blood flow there? That is something you can do with acupuncture, and you can visibly see the effects of that pretty immediately.
What's interesting, Sandra, is when you start thinking about bringing in different kind of blood flow and whatnot, maybe that would be ingredients that we'd use, but it would be very temporary because we inserted a needle for the neuromodulator injection. You have some blood flow there. It's very temporary. I think what you're talking about is sustained blood flow and sustained vitality to the tissue. That doesn't happen with neither fillers nor neuromodulators. Maybe we can try to approach that with like herbals or an inside out approach, but that's very interesting. Now, you mentioned, and I want to be fair on these comparisons, you mentioned you might not be able to soften something as much as a neuromodulator. Can you talk about the side effect profile? What are the side effects that you typically see with acupuncture or facial acupuncture? Let me even broaden it to aesthetic acupuncture. What would be the side effects that one might expect, or should you expect any?
I mean, the most common one, if you'd call it even a side effect, is bruising. Certainly, any kind of needle to the face, because it's so vascular, can create bruising. But that's usually something that's very temporary. And I also notice that as you go through time, like if you're treating the same patient, if they have a tendency to bleed in the area that you're needling, that can cause some bruising initially. But as time goes on, as you're treating them, maybe it's their third or their fourth treatment, there's less of a tendency to bleed and therefore bruise, because a lot of times, according to the way we see it in Chinese medicine, you can bruise more if there's a lot of what we would call blood stagnation going on in the local tissue. And what that means is that's an area where maybe the tissue is chronically and excessively tight. Maybe the blood flow isn't able to move at an optimal level, so that there is more like clogging or pooling of blood versus a nice, smooth and ongoing flow. So those kinds of areas can bruise more easily initially, but as time goes on, as the blood flow begins to improve, you'll see that occur less. So for me, I would say that's that, and maybe a little bit of soreness, because, when you've had chronically tight muscles that have just been held tight for so long and you relax them, it's very similar to when you work out. After you work out, you'll feel a little muscle soreness. But again, that's really temporary and usually not something that really bothers people. So I'd say bruising and maybe a little soreness.
All right. Well, Sandra, I'm totally interested now because it sounds like it can do a lot of stuff for the patient. It sounds like it's fairly safe. And so now I'm starting to think, well, who are good candidates for this, right? Because first lesson I learned about aesthetic dermatology is the correct patient selection, right? So who do you find are the good people that really benefit from the treatments that you do? Or another way to look at it is for the people listening at home, be it dermatologists or other clinicians, who should we refer to you?
Well, I would say that everyone would benefit just because the use of acupuncture really brings more health to the skin, to the tissues, and ultimately to the body. I mean, you have needle points or acupuncture points that relate to your organ systems in your face. And so, from a Chinese medicine point of view, working on these areas and opening up and invigorating these points can have a larger effect on your whole system. So there's that health benefit. Then there's the health benefit of, simply that insertion of the needle, and then you can apply technique to the needle. So you don't always just insert it and leave it. There can be sort of these lifting and thrusting techniques or different angles that you might needle and work into the tissue. All of that can affect the local health of the tissue. So bringing more blood flow, bringing more nutrients, making that area more supple, relaxing that muscle. That's going to benefit anyone and everyone, in my opinion. But as far as people who are looking for aesthetic treatment, I think that when most people think about looking for cosmetic work, they're thinking about filler or neuromodulator or surgery. And they've heard of facial acupuncture, but maybe they don't really understand, well, what exactly can facial acupuncture do? Because, when you think about neuromodulator, you're thinking, oh, it can maybe relax my 11s, or, oh, people know that it can relax the jaw, or, sort of shrink the size of the jaw muscle and slim that lower face. So people kind of know what they're looking for with Western cosmetic work. So, and they don't know as much of what can be done with facial acupuncture. So I think that the first thing that we can do, and this is why this podcast is great, is start to educate people. What could facial acupuncture do and how would it compare to those other things? But before we go there, I will say, to answer your question more directly, a lot of the people that come to me are either just generally interested in natural ways of doing things. They like to live a quote unquote clean, green, natural life. They look for natural supplements. They look for natural ways of, resolving physical ailments. So these types of people usually are very game for facial acupuncture. Another set of patients who come are those who perhaps have autoimmune disorder, or I have patients who have had cancer and have been, successfully treated. And, the types of patient populations that worry about certain kinds of chemicals going into their body and how it will react, if they're immunocompromised or have had these conditions that, they're not sure what could cause that. And so they want to watch for the types of chemicals or materials that they might bring into their body. So I find that those types of people like to think about modalities like facial acupuncture.
Sandra, that's very interesting because you alluded to other benefits, and I wanted to ask you because I always think about traditional Chinese medicine as a more holistic way of treating any ailments and a combination of them, if you will. And I was wondering, as you were treating these people's faces and kind of being aware of other medical conditions that can happen on the skin and on the face, have you noticed any benefit that occur, sort of a synergetic effect, perhaps, I don't know, on rosacea or acne or any other conditions that really manifest in the face, or maybe beyond? I don't know, maybe the effect is more systemic.
Well, I find that with specifically rosacea and acne, I find that treating those conditions topically can be part of the way to resolving the condition, but not 100%. Like, still think that, at least for me, with the chronic hormonal acne or just acne that they've struggled with for a long time, same thing with rosacea, that they need an internal solution as well. But while, an internal solution, in my case, it would be treating them with Chinese herbal medicine. And that takes time and sometimes, a fairly long time compared to what people might imagine or would like ideally. So it can take anywhere from like 3 to 6 months and sometimes longer for really, really stubborn, intense conditions, sometimes up to a year. So in the meantime, I find that using a treatment like facial acupuncture can be helpful. It can certainly be helpful in relaxing their nervous system, which I believe is part of the root of what is creating that chronic inflammation at the surface of the skin. So certainly acupuncture can help in a whole body way, in that holistic way of supporting relaxation of the nervous system, which I think is underestimated in a lot of, dermatology, how important that is. And in terms of the local area of treating the face, it can be helpful in just moving that blood circulation. I mean, in Chinese medicine, blood circulation is like everything. Like we're always trying to improve, increase blood flow, energy, or qi flow. And we find that that is helpful in moving a condition along towards resolution. So in the case of acne and rosacea specifically, though, I don't think it's within the bounds of perhaps this conversation, but I actually use a different kind of treatment that's a little bit beyond acupuncture. It's beyond simply applying or inserting a needle into the skin. I actually do something where I drain the excess blood and fluid out of the area. And I find that to be very helpful in helping the condition along.
Right. No, absolutely. Thank you for saying that. And actually, I agree with you that just releasing the stress can oftentimes help conditions on the skin, especially, in combination with other therapies. But certainly, I agree with you that stress and the way our mind works certainly helps to exacerbate a lot of chronic medical conditions. And that's why we decided to focus our upcoming Integrative Dermatology Symposium on the mind and its powerful effect on health in general, and maybe we'll shine some light on its effect on the skin. So definitely join us to the Integrative Dermatology Symposium. And speaking of being holistic and complementing other disciplines, I was wondering, and that was kind of a follow-up question, when people come to you and maybe they've done some other treatments in the past, do you find that acupuncture maybe complements other procedures? Let's say they had a filler and then just need a little softening of the lines together with it. Do you find that synergy?
And Sandra, can I pack on to that question just one little additional thing if you can touch upon? Is there a mind-body component to this that's just not addressed by other modalities that you can tap into?
I think so. I think that the way that you can strategize a treatment for a patient, you can just be local, right? You can just say, oh, this muscle is tight. You can feel nodules, you can feel knots and maybe tight bands, and you can simply release that, right? You could apply your acupuncture in a very strictly like local, just looking at the physical concern and just treat that. Typically with acupuncture, we're looking at that and beyond. We're looking at, okay, what is the area of concern? So similar to the way that we might treat neck pain. So a person comes in and their neck hurts. So we're looking at their neck, but we're also looking at what is contributing to the neck pain. That might be something that lives in the psycho-emotional place. So for us as practitioners, the organ systems and thinking about physiological system of the body from a Chinese medical point of view always encapsulates psycho-emotional concepts. So for instance, if someone has a lot of neck pain, we would say, we say that the neck often belongs to the liver. The liver is an organ system that deals with anger, frustration, sort of, acute stress. So we're always looking at the psycho-emotional and the physical together in that regard. So if I'm treating the neck pain, I might look to see if this patient is also having some liver qi stagnation. And if that's the case, I would want to resolve that because that would be an important root to treat that's causing and contributing to that neck pain. So similarly, when I look at the face, I basically think of the face in a it's just another part of the body, just happens to be the face. So if I'm looking at an area like the jaw tension, very much connected to neck tension, very much connected to liver, which you could maybe roughly translate as nervous system activation issues. When we're really activated in our nervous system due to stress, due to overload and overwhelm, that can really activate our liver organ system, and we might need to soothe that. So then there's a different set of points that exist on the body, maybe the hands, maybe the feet, maybe the lower legs, maybe the forearms, that would speak to the liver qi stagnation. So what's great about a facial acupuncture treatment is you can treat all of that in one session, and you can sort of accomplish quite a bit in one session. And that's why our treatments are holistic or whole system based.
Wow. Raja, considering the pandemic and the fact that Americans don't take any vacation time and we're all workaholic,
no kidding.
I'm like thinking, is there any stress here? Yeah, there's a lot of it. And thank goodness that this has that kind of extra benefit for those who are interested.
Sandra, where are you located again?
I'm in Brooklyn, New York.
Hadar, we need to get a direct flight to Brooklyn, New York, my friend.
I know, you're reading my mind. I'm packing as we speak. But, I wanted to get back to that question, and maybe you could think of some synergy that you see with other more traditional aesthetic procedures. Have you noticed anything like that in your patients?
Yeah, I love this question. And, at the conference, since it's an integrative conference, I would love to dig into this more. I think that for me, what I've noticed is that when someone's coming to the end of their neuromodulator, maybe it's like that 3-month or 4-month mark and it's starting to wear off a little bit. I find that that's where we can apply acupuncture and or some of the other TCM tools like Gua Sha, cupping, and it can help extend that time between when a patient might feel they need another hit of the neuromodulator. With fillers, I find that what I've seen a lot personally is people that have had fillers before and have how sometimes, and I don't know if this is the correct terminology, but sometimes I find that where filler has been in the past can have kind of like a tight band, or almost, I don't know if you would call that like a type of scarring under the skin, which I've seen this under the eye in particular. And I find that that can cause some problems with the skin laying smoothly at the surface. So I'll sometimes do some light acupuncture into that area, just to kind of try to release it and break it up. And I find that the skin is often able to lie a bit better over that type of area. So, but in terms of filler, when it's, still active, I'm a little nervous to mess with it too much because I'm actually not sure what the effect of that would be if I was to stick a needle in there. So that would be a question I'd love to throw back to you, actually.
Absolutely. And, I think we can definitely discuss this at the Integrative Dermatology Symposium. Raja, I just got a call from my agent and he said, don't pack just yet. You're not going to Brooklyn. You are all going to the Integrative Dermatology Symposium coming up September 30th. And believe it or not, Sandra's going to be there as well. And we can continue to dig in and poke into these issues left and right at will. Sandra, I really want to thank you for taking the time today, because I was a little confused about facial acupuncture and what it can do for my patients. And now I feel like I got a really good sense of how they can benefit from that. So thank you for sharing all your expertise with us. And I look forward to seeing you at the IDS.
My pleasure. Thank you so much for having me. I love talking about this stuff. And I really look forward to having that conversation with you and the rest of, the medical community that will be there, because I just think there's so much that we can explore and research together and find, new paths and new options for everyone out there looking for aesthetic treatment. And I think that that's really exciting that we could bring these together. So I love the integrative aspect of this conference for that. So I look forward to seeing you and everyone.
Thanks, Sandra.
Hey, Raja, do you know where the integrative medicine movement started?
According to Google, since Google knows everything, Dr. Andrew Weil founded the Center for Integrative Medicine at the University of Arizona in Tucson back in 1994. Why do you ask?
Well, you know how we always try to get to the root cause? I think we need to go big for the fifth annual Integrative Dermatology Symposium. How about we do this? Let's meet at the Los Ventana Canyon Resort in Tucson, Arizona. Or you can join virtually from September 30th to October 2nd and hear from the world-renowned experts like Andrew Weil.
Exciting. And our theme is connecting mind, body, and spirit to take a more holistic approach to our patient care. What do you say?
Absolutely. I mean, where else can you get the latest on diet and dermatology, hypnosis, botanicals, common diseases, aesthetics, and other unique topics in dermatology with practical takeaways to start using in clinic right away?
So true. And let's not forget, we've got the new track for estheticians too. I think I'm going to need to call in a sick day or two before the symposium so I can enjoy the waterfall and trails on the resort, stargaze, play a round or two of golf or tennis, relax at the spa, and catch up with colleagues at the evening receptions.
Yes, that place is spectacular. You know, use our discount code POD25 at checkout for 25% off.